Being a homeopathic psoriasis specialist, and how and why one should be a homeopathic psoriasis specialist or any specialist. I am Dr. Rajendra Sonawane. I am India's first homeopathic psoriasis specialist. I am India's first homeopathic psoriasis specialist. So the question comes in homeopathy, how I became a specialist, and I am going to tell you the importance of being a specialist. Number one, when I got my homeopathic qualification, the highest qualification in India, Dip.N.I.H, and I wanted to start my practice. So in those days, even today, the homeopathic doctors are specialists in the chronic diseases. That is, those disorders that do not have a permanent treatment or a proper treatment in conventional medicines. And that's why they call themselves as specialists in the chronic diseases or Junat or Asadya Rog Tadnya. So in those days, in earlier practice, 35 years ago, I used to call myself as a homeopathic consultant and specialist in the chronic diseases and a number of other diseases I used to treat. But people used to ask me that if you are a homeopathic doctor, what does mean a homeopathic consultant? What diseases you treat? What specialist you are? Because homeopathic specialist, this word does not indicate any disease because people want to know and they have a conception that there are gynecologists, that is specialists in the female disorders, skin specialists, there are cardiologists, that is specialist in heart disease, diabetologists. So what is your specialty? And this really haunted me, that what I should do and what I should introduce myself as a specialist. If I say I am a specialist in all disorders, right from diabetes to cancer to all disorders, it means that I am not a specialist in anything. Specialist is doctor who treats one group of diseases or he treats a single disease, that is a super specialist. So that question was haunting me and I wanted to be a specialist. In initially I treated a few cases, chronic cases of paralysis, of cancer, of asthma, something like that. But I do not have a large number of cases of any single disease. And once in a while, it happened that I treated a patient of cancer and he lived long. And I said that I treated a patient. But a allopathic doctor, a friend of mine, he told me that one case in 1 lakh is autorecessive. That is, it can get automatically cured. So you cannot claim yourself as a specialist unless and until you treat a large number of cases of a single disease and you really prove it that you have treated it according to the modern science. So that's what was in back of my mind, and gradually I really started what should be my specialty. And in those days I found that I have lot of patients of psoriasis which I am giving good results, and definitely it is one of the diseases that is not having a treatment, permanent treatment in modern science. And people, even in my science, they used to say that this is a difficult to cure, this is incurable. So this was really a good scope for me to start a specialty in psoriasis. So I started treating the cases of psoriasis, more and more cases. The first thing I did is I stopped treating other cases so that I can give more time to my cases. So this way one can be a specialist. Then another need for a specialist is that because you can be a specialist in one domain, that is you can be a dermatologist, you can be a gynecologist, but for that do you need a qualification, a specific qualification? For example, in allopathic science, there are specialists in heart, they have a specific training, but in homeopathy, we have a speciality in our subjects. Like Matramedica is there, Organo is there, Repertory is there. But we do not have a specific specialist, whereby it is a strong demand from the public that you should be a specialist in some subject. And for that, you have to start on yourself and how to be that. So that day, I decided to take psoriasis. I'm going on and on and on, more and more cases, more and more expertise. And this way, I had a lot of cases, today 24,500 cases of psoriasis being treated by me. It's a large number in India. And this way I started from being a homeopath to being a homeopathic psoriasis specialist. And that is what how one becomes a specialist. And definitely I am a today specialist because I have a number of cases and I treat only psoriasis. So that is the super specialty. Definitely we at Psoriasis we guide the people to be psoriasis specialists, and today onwards I will be posting and I will be having a live video every day for how to be a specialist and what are the things to be needed to be a specialist, how was my journey and how I did it. Please listen to this video if you want it, and I will be there live for all 30 days. I will be sharing my experiences, I will be sharing my guidance. Please listen to it and become a super specialist, become a homeopathic specialist. It is really needed and people need it. And I think it is a great contribution of homeopathy. And definitely we can show how homeopathy works. Thank you.